Good evening, everyone. So, dear friends, today we are going to discuss about the heel pain. It is a very common problem, heel pain. So, let's start the discussion. So, what is heel pain? There are mainly three causes of the heel pain. There may be three reasons of the heel pain. Number one, number two, and number three. Let's discuss one by one. The some heel pain are very easy to cure, but some heel pain are very difficult. So, the number one heel pain is called. So, heel pain number one. I am writing here heel pain number one. Heel pain number two, and heel pain number three. So let's discuss the heel pain number one. The heel pain number one, we can see the image of legs. In the ankle joint, we are having total 7 bones. There are total 7 bones are in the ankle joint. So look at this ankle joint. In the ankle joint only, we are having 7 bones. Calcaneum, talus, and the 5 other bones who are in the front side. We can see here, these are the other bones like cuboid, cuneiform. This is also cuneiform. In this way, we are having total 7 bones. Right now, I don't want to discuss all the 7 bones, just I want to focus here. Come back here. So this is the bone. This is the one bone out of 7 bones. So in the ankle joint, we are having total 7 bones. So in this part, we are having total 7 bones. And the lowermost bone, this is called calcaneum. So this calcaneum is the number one cause for heel pain. Because what is happening? There is a one bone growth, little bone growth is happening in the calcaneum. The growth is called Spur. The growth is called Spur. This is the very common type of heel pain. This growth is called Spur. Or we tell it calcaneal spur. So the meaning of calcaneal spur is there is unwanted growth. There are 3 types of heel pain. And we are discussing the number one type, that is calcaneal spur. So number one type of heel pain, that is calcaneal spur. This is the number one cause of heel pain. Why it is happening? What is the reason? So the question is, this is the ankle joint. And this is the bone. The name of this bone is calcaneum. The question is this: if there is an unwanted growth in the calcaneum or spur in the calcaneum, so this spur is paining or something else. So whether this pain because of spur, the whether this pain because of unwanted growth So what is the real reason? So the answer is no. This pain is not. This pain is not because of spur. This pain is because there is also some redness, some inflammation, some heat, or something, inflammation around the spur. So look at the feet. Let's go and see the feet. This is the feet. So we can see this is the feet. And this is the bone. The name of this bone is calcaneum bone. So if there is an unwanted growth in this bone, it is called spur. The growth is like a sprout, like we are. We can see the sprouts in the seeds in the same way. If there is a unwanted growth, like a sprouts, so we can see the spur in the calcaneum bone. So this growth is like a sprout. So this is the number one cause of heel pain. Okay. Now what is the second cause of heel pain? Look at this structure. We can see this strong fascia. We can see this strong fascia. The meaning of fascia, who is attaching one bone with another bone. So we can see this is the, because in our body there are lots of structure, bones, fascia, ligaments, muscles, blood vessels. So these are the fascia we can see here. The fascia is spreading from here till here. These are all are the fascia. The name of this fascia is plantar fascia. So the second cause of the heel pain is this fascia. Many person getting the heel pain because of this fascia. What is happening? Why they get the pain here? So this fascia is pulling the structure because this fascia can pull the, if this fascia is more contracting more, then it may pull the this bone towards this bone. So we can keep both the causes under one. Number one, cause of the heel pain. So number one cause of heel pain is spur in the calcaneum bone or contracted plantar fascia. So too much contraction in the plantar fascia, or this is called plantar fasciitis. So when this types of patient coming to us, he is having too much pain at this location. Look at my feet. I am doing the demonstration. So when this types of patient coming to your clinic, so look at my feet. 1 minute. Yeah, look at my feet. So this is the plantar fascia. So the plantar fascia is starting from here and coming till here, till all the toes. So this is the plantar fascia. It is giving the strong attachment. So we can take the help of this calcaneum bone and this upper bone, and we can do the synchronized movement with the help of this plantar fascia. But if this plantar fascia is contracted and having more pulling, then this person will get the too much pain here, this part and this part. If you press here, patient will, oh, too much pain here in this part. If you press here, too much pain. So this part is very painful, even this part. In the calcaneal spur, as well as in the plantar fasciitis, this part is too much painful. So this is the number one cause of heel pain. Now, the second cause of the heel pain, this is the tendon. This is the tendon. What is the name of this tendon? Okay, what is the question? That why is this pain? What is the reason of this? Okay, so the heel pain because of reason number one. So the why this pain is happening? The first cause. The many people are walking a lot or doing the gymming or walking on the hard surface without good shoes. So when you are walking, you should have a good quality of shoes. If you are walking on the flat surface, hard surface for longer time, you should wear a good quality of shoes. Otherwise, with the wear and tear, this spur will appear. And even with the heavy walking, more walking, because when we do the walk, when we do the exercise, the fascia are contracting. And if this fascia will contract a lot, even it will create the flat foot. Okay, we'll discuss the flat foot later on. So now, the second cause of the heel pain is what is the question? Why is not touching? Yes, definitely long standing can cause the plantar fasciitis. Why is not touching heel on the earth at the time of walking? No, no, no. You should touch the heel. But the thing is this, many person doing lots of exercise, lots of walk, many kilometer walk, and this is the cause number one. Cause number two, overweight. Overweight. So the fascia and joints has to bear the more weight. Third cause. If someone is suffering with the rheumatoid arthritis, so in between joints they are having inflammation. Someone is suffering with the diabetes, so there are poor nutrition. So there may be many causes, triggering factor. The overweight is one of the cause of this calcaneal spur and plantar fasciitis. Now, second types of patient coming, they are having more pain here on the back side. They are suffering with the more pain here on the back side. Too much pain here on the tendon or on the Achilles tendon, and they are suffering with more pain if they do the stretching like that. If I stretch my tendon, see, if I stretch my tendon, see, this is my tendon is relaxed. You can see. my tendon is relaxed. Right now my tendon is relaxed. You can see this tendon is relaxed. But now I do stretching. Now I do stretching. So when I stretch this part, so this is painful. When I doing the stretching, so it is painful. So this tendon is painful because the tendon is inflamed. So this is the second type of heel pain. And this is called Achilles tendinitis. Achilles tendinitis. And this Achilles tendinitis happening with a person like a sportsman, like a runners, like a climbing on the hills, doing the trekking, like getting down from the hills, hilly places. So this tendon on the back side of the heel get inflamed, and this condition is called Achilles tendinitis. So the second condition is called Achilles tendinitis. It is also very common cause for the heel pain with the sport, for the sporties, for the sport personalities. So the second cause, second types of heel pain is happening with the sports person, climbing the hills, getting down from the hill, and increasing while stretching, increasing while stretching the Achilles tendon, Achilles tendon. So let's see the location of Achilles tendon. So look at the legs from the back side. This is the Achilles tendon. Very long tendon, giving the very strong support from heel to calf muscles. We can see this is a very strong tendon on the back side of the leg. So this is called Achilles tendon. And with the sports C, with the runners, this get inflamed. This is called Achilles tendinitis. So this is the second cause of heel pain. So the first treatment is giving the relaxation. So these types of pain is happening to the sportsmen, but when they are walking, after getting body warm, when body happening in coming in the warm condition, and tendon is little warm, then they don't feel pain. But initially they are having too much pain, and this pain is more common while doing the stretching, when they stretch. Okay. Now, third cause of the heel pain, the final and third cause of the heel pain is bursitis. What is bursitis? The bursa is like a sack, like a polythene filled with liquid. Bursa is a liquid filled sack. Bursa work like a shock absorber. Shock absorber. So the bursa found in all the joints. Bursa is available in all the joints. Even this is the leg. So this is the tendon, Achilles tendon. And this is the bone. So between bone and tendon, we are having bursa. For avoiding the friction, bursa. Okay, let's see other image. So look at this image. So we can see here, this is the tendon. And this is the bone. Between tendon and bone, we are having bursa here. For avoiding the friction, this is the bursa. So this is the bone, the name of this bone is calcaneum. So this bursa just on the back side of calcaneum. So it is called retrocalcaneal bursa. Okay, so ultimately what I want to tell you, there is a bursa in between bone and tendon. And sometimes what happening with the more walking and improper shoes, and because of overweight, this bursa also get inflamed, and this also cause heel pain. So this is called bursitis. So in this way, there are three causes of the heel pain. Okay, so the third cause of the heel pain. So number one, the calcaneal bone having problem, calcaneal spur, or plantar fasciitis. Number two, the tendon having problem, Achilles tendinitis. Number three cause is bursitis, or we can tell it retrocalcaneal bursitis. So there are three causes. In simply, I will tell you there are three causes of the heel pain. One, this bone having problem, or this fascia having problem. This is the cause number one. Cause number two, this tendon having problem. This tendon having problem. Cause number three, the bursa having problem. Only three cause. So one, problem of the bone or fascia. Second, problem of the tendon or Achilles tendon. And third problem of the bursa, these are the three are causing the heel pain. So what is the treatment as per the acupuncture? What treatment we can do as per the acupuncture? Let's see now. What is the time? Okay, so now whatever happened, whatever happening in the heel, happening because of these reasons only. These reasons are responsible. So let's see the treatment protocol. So the first point will be DU20. DU20. Why DU20? Because if you see the whole body, so there is a relationship of top and bottom. If some problem is in the top, you can treat the bottom. And if some problem in the bottom, you can treat the top. So top is treating the bottom and bottom is treating the top. So this will be the point number 1, DU20. And DU20 is very good point for the heel pain, DU20. So this will be the point number 1. The point number 2, so we will apply the formula TADI, TADI. Especially we will apply T means DU20. So DU20 is the tranquilizer point, reducing the pain. A means analgesic point Li4. So we'll set it the Li4. And I means influential point. So we will take the gallbladder 34, which is the influential point for fascia, muscles, tendon. So we'll take 3 points mainly. So we'll do the even method on the DU20, sedation of the Li4, and even method on the gallbladder 34. This is the starting of treatment. This is the common treatment. So let's see the location of all the 3 points. Then we'll proceed further. So look at my hand. The first point is DU20. So the DU20 is on the tip of thumb, on the uppermost point of the thumb. This is the DU20. The tip of the thumb, that is the DU20. So we'll apply the star magnet or we'll put the methi seeds here on the location of DU20. Look at here. This is the great tranquilizer, great painkiller point. बंद करो, उसका गम छूट जाता है. The second point will be, we are putting the second point will be Li4. So on the wrist, this is the wrist, we are having Li5. So we have to put the Li4 point. So this is the Li4. So this is the joint. On the joint we are having, because this is the Li meridian. So this is the point, Li4. The second point is Li4, and we will sedate the Li4. So we can put the Li4. Sedation of the Li4, we can put the points bilateral. Look at the point, Li4. And third point will be gallbladder 34. So on the joint, we are having the central meridian is gallbladder meridian. So on the joint, we are having gallbladder 35. If you go just 1 millimeter down, that is gallbladder 34. Gallbladder 34. So put the third number point. So now we are putting the third number point. That is gallbladder 34. So let's see. Doing the renting method, even method. Like when someone is suffering with lots of pain, then we are doing the sedation. So this is the location of gallbladder 34. Just 1 millimeter down from the joints. So this is the common point, and we are using multiple times for the pain in the pain happening anywhere in the body. Now coming back to our protocol. So 3 points are common. Now 4th number point. Like someone is suffering with great pain, so we will sedate all the point. DAY2 sedate, Li4 sedate, gallbladder 34 sedate. When someone is suffering with a greater pain, we are sedating all the points. DAY20 sedate as a tranquilizer point, Li4 sedate as a painkiller point, gallbladder 34 sedate as a influential point. So sedation of 3 points. Now, if the problem, now talking about the influential point, if we talk about the influential point, sorry, because heel pain is very, very big problem. We are having total 8 influential points in the human body, and we know that. We are having total 8 influential points. Some point working for the bones, like urinary bladder 11. Some point working for the fascia and muscles and tendons, like gallbladder 34. Some point working for the blood, some for the blood vessels, some for the different bone, marrow. In that way, we are having total 8 influential points in the human body. So why I chose the gallbladder 34? Because there may be problem of the tendon, there may be problem of the fascia, and there may be problem of the muscles. But if problem happen of the bones, so we can also take the urinary bladder 11. Urinary bladder 11 is the influential point of bone. But as per practical experience, I will tell you, the gallbladder 34 is working more efficiently. We can take both the influential point together. So our formula will be like this: DAY20, Li4, gallbladder 34, even we can add urinary bladder 11. So the D24 will be the tranquilizer point. Li4 will be the painkiller point. And these two will be the influential point. One for muscle, one for bone. So 1, 2, and 3. Now we will use local points. The most important points are local points. So I will show you one video. Then I will show you how to put in the sujok. So look at this image, look at this video. So this is the kidney 6 point, the locally. Just on the back side of this medial malleus, this is the kidney 3 point, kidney 3 point. On the back side of this medial malleolus, kidney 3. So we can put locally in the body, or we can put the same point, the sujok by magnets. So this is the lateral malleolus and this is the depression. If from the lateral malleolus we go 3 chun up, this is the location of gallbladder 39. So I am putting the gallbladder 39. And this is the gallbladder 40 in the depression. Anterior to the lateral malleolus, this is the gallbladder 40. Then going on the lateral side, so this is the lateral malleolus, urinary bladder 60, just back side of the lateral malleolus. That is the location of urinary bladder 60. And from this point, if we go 1 chun down, near about, if we go 1.5 chun down, that is the 61. So this is the protocol. We can put locally. Okay. Let's see how can we put in the sujok. This is for the acupuncturist. But suppose, first I would like to write all the points. Then I will tell you how to put. So the treatment protocol. Number 1, DAY2, then Li4, then gallbladder 34, and urinary bladder 11, plus local points. The local point, I will show you kidney 3, 4, and 5, urinary bladder 60, 61, gallbladder 39, 40, and 41. That's it. These are the local points. So with the help of these points, we can treat all types of heel pain. Either this is the heel pain happening because of the tendon, because of the fascia, because of bursa, or because of bones. Okay, so we'll discuss the location of these points maybe on the next class. Okay, so thank you so much. Good night.